Hi, good morning, I'm Lewis Parker. I'm the invigilator for the OET test conducting on 28/06/2020. May I know your name, please?
Hi, good morning. My full name is Lisabelle.
Can I have your passport, please?
Yes, sure.
Can I have your candidate number, please?
My candidate number is 156792.
All right. We can now begin the warm-up session. Describe a time you provided effective patient or family education.
I taught a family post-operative spine care after a posterior spinal fusion. I also provide the family with written educational materials and also some demonstrational videos. The parents were able to properly demonstrate how to transfer their child from the bed to the chair. In doing so, I was able to determine that they had retained the information.
Describe a time when your facility was undergoing some change. How did that impact you, and how did you adapt?
One healthcare system I worked for switched from paper charting to electronic medical records and computerized charting. During this transition, it was confusing and often overwhelming. I was able to adapt quickly to the upgradations.
Tell me about a time when you didn't know the answer to something at work. How did you go about finding the information?
As nurses, there is no way that we possibly can know everything. Knowing who to go for help is the first step. At the beginning of every shift, I identify a nurse that I can use as a resource, such as a charge nurse, nurse educator, or unit resource nurse. This individual is generally someone that is more senior with an advanced skill set. If I am unable to get the answer from them or they are busy, I look at the healthcare system's policy and procedure manager. If there is a concern regarding a medication dosage or interaction, I look to LexiComp.
Talk about a time you worked in a fast-paced setting. How do you prioritize tasks while maintaining excellent patient care?
Working in an ICU setting is extremely fast-paced, and it is essential to prioritize your tasks for the day. At the beginning of the shift, I make a to-do list with everything that needs to be accomplished. I put the must-do things at the top of the list and the things I would like to do at the bottom. Administering medications are placed at the top of the list, and washing a patient's hair is further down. While I would love to accomplish everything, it just isn't possible.
Have you ever felt dissatisfied with your work as a nurse? What could have been done to make it better?
I once became extremely dissatisfied because I was consistently being given easier assignments and not being given the ICU-level patients. It became frustrating, and while I understood that others needed to learn and gain experience, it quickly left me annoyed with my position, the unit, and the healthcare system. I sat down and spoke to my nurse manager about my concerns and to inquire why it was happening. The nurse manager was not aware of the situation, and it was later determined that a few of the charge nurses were giving the sicker patients to their friends and not spreading them out amongst the nurses.
Great. Thank you very much for sharing that. So, let's move on to the role plays now. I'll take the part of the patients, or perhaps a relative, and you'll take your professional role. The purpose of the role play is to get evidence of your ability to communicate effectively with patients. Use your ability to fulfill as much of the role play as possible. Do you have any questions?
No.
You have up to 3 minutes to prepare the role play. You will start the role play after that time. I'll let you know when 3 minutes are up. You can ask me if there's anything you are not sure about, and you can make notes on the role play card if you want to. Here's a pencil for making notes.
Thank you.
You can look at the card during the test, but you must return it to me at the end of the test. Please start preparing now.
All right.
The role play will now last for about 5 minutes. Don't worry if I stop you when the time is up. Can you start the role play, please?
Hello, good morning. My name is Lisa, and I am one of the registered nurses in this hospital. Could you please confirm your full name for me?
My full name is Albert Kingston.
Thank you. How may I address you, sir?
You can call me Albert.
All right, Albert. It seems to me that you are upset. Could you please tell me what's bothering you?
I was misinformed by the hospital about my treatment.
I'm really sorry to hear that. May I know the wrong information delivered to you, please?
Yes, one of the staff nurses just informed me that I'll be having an enema today. She didn't inform me about the pain at all.
Oh. I can understand your trouble.
She might have informed me earlier about the procedure in detail, so that I could have prepared myself before it.
To confirm if I have this right, you are upset because you underwent an enema and it was very painful and uncomfortable for you. Is that right?
Yes, it's very disgusting and highly painful.
Don't worry, we are here to help you.
Yes, I know, but it was really a terrible experience.
All right, I acknowledge your situation. So could you please tell me, did the pain last just while the procedure, or are you still having any pain?
I'm not in pain anymore. But I feel uncomfortable. No one can understand what my situation was.
I understand what you are saying, Albert. An enema is generally not painful, but in some cases, people might experience a bit of pain if their bowel is too sensitive.
Yes, that's what I'm trying to say. If the staff nurse had informed me about the pain, I would have been prepared mentally and physically.
I take your point, Albert. I guess you were upset because of the reason that you were not given a warning about the pain earlier. Am I right?
Yes, you are absolutely right. The misinformation made me angry and upset. It affected my mental health and created a wrong impression against the hospital.
That being said, it does sound like you had an awful experience. It's a reasonable reaction to be angry, and I am sorry that you had to go through that. If I were you, I would probably react in the same way.
Also, she didn't explain to me about the need for an enema. Being a patient, I have complete rights to know about the procedures which are assigned to me. Isn't it?
I understand your perspective. The reason why the doctor advised you to have an enema was because he was worried that your symptoms were related to something serious like cancer. However, I am glad to tell you that your results are fine and it's not a serious condition.
Oh my God! Did the doctor suspect cancer for me? Was this test enough to confirm that?
Let me reassure you that you have nothing to be alarmed about. Although the experience was distressing for you, it performed as a precautionary measure, and your results are absolutely fine.
All right. And nurse, still I'm feeling uncomfortable. Can I get some medications for my bowel?
Sure, the doctor will be here shortly. Kindly discuss your complaints about abdominal discomfort and change in bowel habits with him, so that he can provide you with some effective management. Does that sound good?
Yes, really thank you very much for your kind approach.
You are welcome. By the way, don't be upset anymore. We are here to help you out.
I'm really grateful for that.
All right, if you need anything or feel any discomfort, please ring the bell on your right-hand side. Nurses will come to assist you.
That's great, thank you.
You are very welcome. Thank you for watching. Please, like this video and encourage us.
Subscribe and stay tuned for more videos. Kindly comment your suggestions and help us do better.